All right, so we're back again, and we have the pleasure of having Dr. Seth Lederman with us, who is a co-founder and the CEO of Tonix Company. He's a doctor, associate chair of medicine at Columbia, and he's gone on venture and has really investigated many different companies. But your concentration today is fibromyalgia and PTSD, which we've gotten so many phone calls, and it's a pleasure to have you on the show. And the sleep pattern. So tell us, first of all, how you got into this field. What's the interest as far as fibromyalgia? And tell us exactly what fibromyalgia is.
Terrific. Well, let me start by thanking you for having me on the show. I'm a fan of the show. I think you do a terrific job of communicating really complicated medical issues to people, and there's a huge need for this in society. So I'm really honored to be a guest on the show.
Pleasure to have you.
I was actively practicing rheumatology as a professor at Columbia University, as you said, and I realized that probably half the patients that came through the rheumatology clinic had fibromyalgia, and yet at that time they were ignored. The training of not only Columbia but many other people tended to denigrate these people's complaints and ignore them. And I thought that this is probably the biggest problem in rheumatology. In fact, the name rheumatology comes from rheumatism, and many people believe that fibromyalgia is a new word for rheumatism. So this is a huge problem affecting between 5 and 15% of people in the United States. And I became passionate about trying to find a medicine to help these people.
Seth, I think part of the problem is that a lot of patients with fibromyalgia, and again, if you have questions for Dr. Lederman, this is a good time to ask about fibromyalgia, complications of PTSD. It's 877-970-2999, and we're happy to answer your questions. We don't get trained to diagnose fibromyalgia. There's really no good imaging studies. There's no lab tests that I know of. And it becomes almost like a wastebasket for a lot of these patients who have chronic pain. They have ruled out rheumatoid arthritis, Lyme disease, lupus, everything else. And then at the end, it's like, okay, you probably have fibromyalgia. Is that the case, or what has changed over the last few years in this field?
It's still the case that there's no objective test done for typical patients to determine whether they have or don't have fibromyalgia. It's still the case that we have to listen to patients and ask them about their symptoms. But many things have changed. For example, the American College of Rheumatology has come out with a guidance, first in 1990 and then in 2010, that gives very clear guidelines about how to diagnose fibromyalgia. Another thing that's clear is that the subjective complaints, the complaints that the patient are experiencing, are real because there are studies using CAT scans called fMRI, which is a way of looking at the blood flow in the brain of living patients. And in an experimental setting, it's clear that fibromyalgia patients have turned on the pain centers in their brain and that they are experiencing the widespread pain that they're complaining about. Now, one thing that you mentioned about, is fibromyalgia a diagnosis of exclusion? Is it necessary to eliminate all of the other conditions? In clinical trials, we do that because we're trying to look at what's called primary fibromyalgia. But in reality, there's a growing appreciation that many patients with osteoarthritis, patients with Lyme disease, chronic Lyme disease, many patients with these conditions have what can be called secondary fibromyalgia, that their chronic widespread pain is fibromyalgia coexisting with another condition.